The life of Florence Nightingale stands at the crossroads of Victorian society, imperial warfare, and the emergence of modern science. To the casual observer, she is remembered as the lady with the lamp, gliding through dimly lit hospital wards during the Crimean War. Yet such imagery, though powerful, risks reducing her legacy to sentiment. In truth, Nightingale was a formidable intellectual, a statistician of rare discipline. Florence Nightingale was born on May 12, 1820, in the city of Florence, from which she derived her name. Her parents, members of the British elite, ensured she received an education unusual for women of her class. She was trained in mathematics, languages, philosophy, and history, subjects that would later inform her analytical approach to healthcare. Raised in England, primarily at estates such as Lea Hurst and Embley Park. The outbreak of the Crimean War in 1853 marked a turning point in Nightingale's life. Reports of appalling conditions among British soldiers reached the public, describing overcrowded hospitals, inadequate sanitation, and rampant disease. In response, Nightingale was appointed by the British government to lead a team of nurses to the military hospital at Scutari Barracks Hospital. Upon her arrival in 1854, she encountered a system in collapse. Soldiers lay in filth, sewage-contaminated water supplies, and infectious diseases, typhus, cholera, and dysentery claimed far more lives than battle wounds. Nightingale approached the crisis not merely as a caregiver but as an administrator and investigator. She implemented rigorous sanitation measures, improved ventilation, organized supplies, and established standards of hygiene that dramatically reduced mortality rates. Her work at Scutari revealed a critical insight: disease was not an inevitable consequence of war but a product of environmental neglect. Nightingale's insistence on cleanliness, fresh air, and proper nutrition represented a paradigm shift in medical thinking. She demonstrated that systematic reform could save lives on a scale previously unimagined. Nightingale's contributions extended far beyond the wards of Scutari. Upon returning to Britain, she undertook a comprehensive analysis of military health. Using data collected during the war, she produced detailed statistical reports that identified the primary causes of death among soldiers. Her work culminated in the development of innovative visual representations, including the coxcomb diagram, which illustrated the impact of disease relative to combat injuries. In this endeavor, Nightingale aligned herself with the emerging field of statistics, transforming it into a tool of public persuasion. Her ability to translate complex data into compelling visual forms allowed her to influence policymakers and the broader public. Indeed, she became one of the first women elected to the Royal Statistical Society, marking a significant milestone in both scientific and gender history. In this endeavor, Nightingale aligned herself with the emerging field of statistics, transforming it into a tool of public persuasion. Her ability to translate complex data into compelling visual forms allowed her to influence policymakers and the broader public. Indeed, she became one of the first women elected to the Royal Statistical Society, marking a significant milestone in both scientific and gender history. In her later years, Nightingale remained active in public life, though increasingly confined by illness. From her home in London, she continued to write, advise, and influence policy. Her correspondence reveals a mind still engaged with questions of health, governance, and ethics. Florence Nightingale occupies a unique position in the narrative of the 19th century. She was at once a product of her time and a force for transformation, challenging social norms and institutional inertia. Her life illustrates the power of individual agency in shaping historical change, particularly when grounded in knowledge and conviction.